That feeling of shakiness, sharp pain, or a sudden lack of confidence every time you have to step down the stairs is a clear signal that the supporting muscles surrounding your knees might be asleep, forcing your delicate joint cartilage to take the brunt of the heavy mechanical impact. Welcome back to Dr. Sophia. I am Sophia, and today I will guide you through a very slow, gentle, and safe movement routine right here at home to wake up those supporting muscles and ease knee stiffness. Remember, we are not trying to force a cure or push through severe arthritis pain. If you experience a sharp burning sensation, dizziness, or shortness of breath at any point, please stop immediately and rest. Before we begin our first movement, let us make sure you are in a safe environment. Please find a sturdy kitchen chair or stand near a solid wall or countertop that will not slip. Ensure your feet are on a flat, non-slippery floor, and if you are wearing shoes, make sure they have a flat grip. Let us get into our starting position. Sit comfortably on the front half of your sturdy chair, with your spine straight, shoulders relaxed, and your feet planted firmly flat on the ground, hip-width apart. We are going to start with a very gentle ankle lift to stimulate circulation and wake up the lower legs. Slowly lift your heels up while keeping your toes pressed against the floor. Feel a light squeeze in your calves, hold for 1 second, and then gently lower them back down. Let us do this together, breathing smoothly without holding your breath. While you continue this gentle ankle movement, letting the blood flow smoothly through your lower legs, let us address a very common misunderstanding that many adults face after age 60. When you experience chronic stiffness or a dull ache in your knees, it is easy to assume that this wear and tear is strictly a mechanical problem, almost like an old car tire simply wearing down from driving too many miles. You might think the only options are to stay completely still, avoid all movement, or rely on temporary topical creams. But your knees are living, breathing tissue, not inert machine parts. The reality is that the breakdown of protective knee cartilage often starts from the inside out, driven by your body's internal biochemistry. Clinical research highlights a powerful, hidden connection between your joint health and your overall metabolic system. Specifically, the deep fat stored around your midsection, known as visceral fat, does not just sit there quietly. It acts like an active chemical factory, continuously releasing inflammatory proteins called cytokines, such as interleukin-6 and tumor necrosis factor alpha, directly into your bloodstream. These inflammatory molecules travel through your circulatory system and seep straight into the synovial membrane, the delicate lining of your knee joint. Once inside, they trigger a chronic inflammatory cascade that actively degrades the cartilage matrix from within, making it soft, fragile, and highly vulnerable to everyday walking pressures. It is a dual challenge. Chemical inflammation from your blood weakens the structural integrity of the cartilage, and then mechanical weight accelerates the wear. Let us do a quick awareness check right now. Pause the ankle movement, place your hands gently over your kneecaps, and take a deep, calm breath. Feel the surface. If your knees frequently feel puffy, warm, or stiff, even after hours of resting in your favorite chair, your body is signaling this internal biochemical stress, not just simple structural fatigue. To shield your joints, we must send a precise physical countersignal to clear out these stagnant inflammatory markers, and that is exactly what our next gentle step will do. Now that your calves and ankles are beginning to warm up, let us move smoothly into our next activation step. While remaining safely seated on your sturdy chair, we are going to wake up the nerve pathways and sensors around your joints, known as mechanoreceptors. These tiny sensors send vital signals to your brain to help control your balance and protect your knees from sudden missteps. Gently extend your right leg slightly forward, keeping your heel lightly resting on the floor or floating just an inch above it if that feels comfortable. Begin drawing slow, steady circles with your right big toe, as if you are tracing the shape of a small coin in the air. Move with complete control, making 3 slow circles clockwise, and then 3 slow circles counterclockwise. As you do this, breathe naturally. Inhale deeply through your nose and exhale slowly through your mouth. You might feel a gentle pull or hear a tiny click, which is completely normal as long as it does not cause any pain. Return that foot to the floor and gently repeat the same slow circles with your left foot, 3 times one way and 3 times the other way. Next, let us activate the knee joint itself without placing any body weight on it. Lift your right foot slightly off the ground, bend your knee gently to draw your foot back toward the chair, and then slowly straighten your leg forward. Do not lock your knee at the top, keep it soft. Let us do this simple unloaded movement 3 times for each leg. This action begins to distribute a small amount of fluid to coat the joint. If your knee feels too tight, simply slide your foot forward and backward along a smooth floor or towel instead. Keep your spine tall, keep your breathing steady, and let your body prepare for our main activation. Now that your knees have been introduced to gentle movement without any weight, let us proceed to our first main activation exercise. This is our mechanical foundation, designed to strengthen your body's natural shock absorbers so that your delicate cartilage does not have to take all the pressure when you walk or climb stairs. To find your starting position, sit back slightly in your sturdy chair, keeping your spine tall and your shoulders relaxed, away from the backrest if possible. Place your hands firmly on your thighs or grip the sides of the seat for maximum stability. Keep your left foot planted flat on the floor to anchor your body safely. From this secure base, slowly straighten your right leg out in front of you. As you extend your leg, pull your toes gently back toward your shin. Right here, I want you to focus your attention entirely on your upper thigh muscle. Imagine tightening or squeezing this muscle as if you are trying to push the back of your knee down toward the floor. Hold this gentle, active squeeze for a count of 3. 1, 2, 3. Then, slowly and with total control, lower your foot back to the starting position. Let us focus on your breathing. Inhale deeply through your nose as you prepare, and exhale smoothly through your mouth as you lift your leg and squeeze the muscle. Never hold your breath. Let the air move out naturally as the muscle works. We will perform 5 controlled repetitions on this right side. Let us do the second one together. Lift, pull the toes back, squeeze your thigh, breathe, and lower. 3. Extend gently, feel that thigh protector engage and return. 4. Lift, hold the squeeze without forcing the joint and down. 5. Lift, maintain a tall spine, feel the muscle working and lower carefully. Plant your right foot completely flat on the floor to support your weight, and let us switch to your left leg. Extend your left leg forward, pull your toes back, and squeeze that left thigh muscle for 1, 2, 3, and slowly lower. Repeat this with me for 4 more slow, rhythmic repetitions. A common mistake to avoid is rushing the movement or snapping your knee into a harsh, locked position. Avoid forcing the leg completely straight if it feels tight. The benefit comes from the active contraction of the thigh muscle, not from jamming the joint. Also, make sure you do not lean backward or slouch your lower back as your leg lifts. If extending your leg fully causes an uncomfortable pinch or feels too demanding today, we have an excellent lighter version. Simply keep your foot resting on the floor, slide your heel forward a few inches, and practice just tightening your thigh muscle right there against the ground without lifting the leg at all. This floor-based squeeze sends the exact same protective signal to your muscles without putting any stress on your knee joint. You might feel a pleasant warmth developing in the front of your thighs, which is a perfect sign that your natural joint protectors are waking up. Now that your thigh muscles are fully awake and ready to support your alignment, we are going to move directly into our core biological strategy, joint pumping. This movement is specifically designed to nourish your knee cartilage from within. Unlike your muscles or skin, joint cartilage has no direct blood supply to deliver nutrients. It behaves exactly like a natural kitchen sponge. The only way it can receive nourishment and clear out metabolic waste is through a continuous, gentle cycle of compression and release, which draws fresh synovial fluid into the tissue. This process is called cartilage hydration. Let us begin this joint pumping movement together. Ensure your posture remains upright and tall on your sturdy chair, with your shoulders relaxed. Keep your left foot secure on the floor. Lift your right foot just slightly off the ground, keeping your knee soft. From here, gently and smoothly swing your lower leg forward into a light extension, and then allow it to pull back toward the chair in a rhythmic, continuous motion. This should feel like a very slow, controlled pendulum swinging under your chair. Let us connect this to your breath to keep your nervous system calm. Inhale deeply through your nose as your leg bends back, and exhale slowly through your mouth as your leg glides forward. Let us perform 10 to 15 slow, continuous repetitions on this right side. Focus entirely on the smooth quality of the movement rather than how high you lift your leg. Move entirely within your pain-free zone. If you feel any catching or a sharp pinch, simply make the swing smaller. Once you complete your repetitions on the right, rest that foot flat and transition seamlessly to your left side. Lift the left foot slightly, find your smooth breathing rhythm, and begin the slow, controlled pumping motion for 10 to 15 repetitions. Inhale back, exhale forward. A very common mistake here is moving too fast or kicking the leg with sudden force. Rapid, jerky movements generate harsh friction inside the joint capsule, which can actually increase cartilage wear and trigger defensive muscle spasms or exhaustion. You want a smooth, soothing glide, not a workout kick. If lifting your foot completely off the floor feels tiring or causes discomfort today, here is your lighter version. Place a small towel or a paper plate under your foot on a smooth floor. Instead of lifting the foot, simply slide it forward and backward along the ground. This completely removes the weight of your leg while still maintaining the essential fluid pump inside the joint capsule. When done correctly, your knees should begin to feel slightly warmer, lighter, and distinctly less stiff, as if you have just applied a natural lubricant directly inside the joint. Now that we have practiced this joint pumping motion, let us take a brief moment to check our technique and correct a few common mistakes that can inadvertently place unnecessary stress on your joints. The most frequent error I see is what we call locking the knee. When you extend your leg forward, you might feel tempted to push your knee joint as straight as possible, snapping it into a rigid, locked position at the peak of the movement. Please avoid doing this. Mechanically, forcing the joint completely straight under tension jams the bones together, compressing the delicate cartilage matrix and straining the protective ligaments behind your kneecap. Instead, always maintain a soft knee. Stop your leg just a fraction of an inch before it goes completely straight. This keeps the protective tension right in your thigh muscles where it belongs, acting as a supportive shield for the joint beneath. The second common mistake is holding your breath when the movement feels a bit challenging. You might notice yourself tensing your jaw or gripping the sides of your chair tightly. When you hold your breath, it increases the internal pressure in your chest and can cause a temporary spike in your blood pressure, leaving you feeling slightly dizzy, anxious, or needlessly fatigued after just a few repetitions. Remember our simple rule for breathing: let the air flow continuously. Inhale softly through your nose as your leg returns, and exhale gently through your mouth as your leg extends. Think of your breath as the smooth engine that keeps the natural joint pump working effortlessly. Let us adjust this routine to perfectly match how your body feels right now. If your knees are feeling particularly stiff, painful, or tender today, do not try to force a wide swinging motion. Listen to your body and decrease the range of motion. Simply lowering your foot closer to the floor and reducing the swing to a micro movement, just an inch or two forward and backward, is highly effective. This smaller version still keeps the natural joint fluid moving without provoking any sharp pain signals from irritated nerves. On the other hand, if your knees feel warm, stable, and completely comfortable, you can gently progress by standing up behind your chair. Place both hands firmly on the top of the backrest for perfect balance support. Keep your posture tall, anchor your weight onto your left leg, and gently lift your right heel up toward your hip, performing a slow, controlled leg curl. This builds supportive strength in the back of your thighs. Keep the movement slow, stay safe, and let us prepare to look at how our daily hydration and nutrition support this protective routine. Moving seamlessly from our physical movement to what happens in your kitchen, let us explore how your daily nutrition and hydration directly support this protective joint routine. To quiet down the inflammatory cytokines produced by visceral fat, we must choose what we put on our plates with great intention. Clinical evidence indicates that trans fats, frequently hidden in commercially processed snacks, fried foods, and certain margarines, directly elevate inflammatory markers within your bloodstream. At the same time, an excess of added sugars and refined carbohydrates acts like fuel on an internal fire, destabilizing your metabolism and accelerating the biochemical pathways that break down knee cartilage. Under our inside-out shield method, your goal is not a stressful, restrictive diet, but a series of mindful quality choices. Shift your daily portions to prioritize anti-inflammatory whole foods, vibrant, leafy greens, antioxidant-rich berries, extra virgin olive oil, and clean proteins like wild-caught fish or nuts, which closely follow the Mediterranean-style dietary patterns highly recommended by the Arthritis Foundation. Next, let us focus on your hydration baseline, which is the literal lifeblood of cartilage health. Because your knee cartilage operates like a fluid-filled sponge, chronic dehydration leaves the tissue brittle and thin, drastically reducing its ability to absorb daily walking pressure. As we age past 60, our body's internal thirst sensor naturally becomes less sensitive. You might find yourself avoiding water simply to prevent frequent bathroom trips or because of your daily routine. However, systemic dehydration leads to low blood pressure, sudden dizziness, and a significantly higher risk of experiencing a dangerous fall at home. To track this easily without stress, place a clear water flask on your counter or right beside your chair. Take small, consistent sips every hour rather than drinking large amounts all at once. A practical way to monitor your status is to look for a pale, straw-colored urine output. However, we must establish a vital medical boundary. If you live with chronic conditions like heart failure, kidney disease, or are taking prescribed diuretic medications, changing your fluid intake can alter your medication balance. Never change your liquid limits without consulting your primary doctor. If you notice sudden ankle swelling, a rapid increase in weight, or new shortness of breath, stop and seek a professional medical evaluation immediately. Now that we have covered the physical movements and the biological fuel your joints need, let us finish our routine with a gentle cooldown to fully settle your knees and calm your nervous system. Sit comfortably back in your chair, let your arms rest loosely by your sides, and close your eyes if you feel balanced. Take a deep, slow breath in through your nose, letting your belly expand, and exhale completely through your mouth, letting all the residual tension drain away from your thighs and kneecaps. Let us do this breathing cycle 3 times together. Inhale stillness, exhale relaxation. With your feet still resting flat on the ground, gently shake your thighs out left and right just a tiny bit, allowing the muscles around your joints to soften completely. This entire sequence, from our ankle warm-up to our thigh engagement and controlled pendulum swings, is what we call the 5-minute reset. For adults over 60, especially those managing metabolic or mechanical stress, consistency is far more powerful than intensity. Your body adapts to what repeats. I highly encourage you to practice this light protocol once a day, preferably in the morning to wash away nighttime stiffness, or right after sitting for an extended period. As you integrate this habit, remember that these symptoms are messengers. Do not silence the signal, find the cause. While a mild temporary warmth or muscle fatigue is a normal sign of adaptation, you must always look out for internal red flags. If you suddenly notice a sharp, stabbing pain inside the joint, severe swelling, visible redness, or if you feel a spell of dizziness that alters your balance, please stop all activities immediately and contact your doctor. If this routine helped your knees feel a bit lighter and more supported today, please save this video so you can easily practice it again tomorrow. Subscribe to Dr. Sophia for more practical, safe home routines. Thank you for moving mindfully with me today. Take care of your body, and I will see you in our next session.